As dental professionals, many of us think about side effects of medications being, I don't know, xerostomia or maybe drug-drug interactions. But there are some drugs where the side effect is suicidal ideation. That's a big deal.
Find out more today on today's Medical History Mysteries.
Welcome to Medical History Mysteries, everybody. I'm Pam Maragliano. With me, as always, Tom Viola.
Good to
And
see you.
great to see you. We talk about a complete medical history, documentation, asking the patient, finding out if they took their meds that day. There's so many little pearls you've dropped on us over the years. And we should be also looking up medications, especially if we don't really understand the side effects of those medications. But some medications have some serious side effects, including suicidal ideation. Let's talk about that.
It's funny, when we talk about this subject, we don't always think about medications causing suicidal ideation. We believe that maybe it's the patient's condition that leads them to suicidal thoughts. And so taking the medication should potentially avert those thoughts. So it's difficult for us to think that the medication itself can lead to the suicidal ideation. And I have to say, and I've said this in my lab lectures many times, if this isn't the biggest kick in the pants, I don't know what is. You take a medication because you're anxious, you're depressed, you have some type of psychosis, and the medication itself that you're taking to treat these conditions increases your risk of thinking suicidal thoughts. It can even extend beyond medications for central nervous system disorders. A drug like Singulair, which is used for asthma and allergies, can cause suicidal ideation. Ozempic and drugs like it, the GLP-1 agonists, have been linked to suicidal ideation. So the point is, we never know what drug it is that is likely to cause these suicidal thoughts. But the fact that it exists means that we in dentistry have to be in tune to what our patients are saying. When I say this to my audiences, they say, "What do you mean? How do I have anything to do with this?" So for years, I was friends and worked amongst bartenders. And they would always tell me that patients aside, people would come to bars, but they wouldn't be there to buy alcohol. And I'd always scratch my head and say, "What do you mean? Of course, that's why they're there, to buy alcohol." And they would say, "No, Tom, if listen up. People come to buy alcohol in the bar. I'm not some glitzy nightclub. I'm talking about like a neighborhood bar. Because they weren't buying alcohol, they were buying my time. I was the perfect listener. I was a captive audience behind the bar. I couldn't go anywhere. I couldn't hide anywhere. They kept buying alcohol. I kept listening. And I was the perfect listener because I was approachable, easy to talk to. I was basically a stranger to them. I wasn't their family, their clergy person, their loved ones. I was just a person that they could talk to and they could vent and say things to me that they wouldn't say to anybody else. Things like, "I wish, I was never born. The world would be a better place if I wasn't here. My family would be better off if I was never part of the family." All these things that people would say, even sometimes under their breath or off the cuff. And I had to listen to these things, and I had to be ready to respond. Hey, we've all had issues like this in our life, and don't pick a permanent solution to this temporary problem. And there's a lot of runway ahead of you in your life. Things can turn around on like that. Don't go down that road. Call this number, right? These people will help you. And it got me to thinking that, these were bartenders that would say this to me. And I realized that that's kind of the role we play in dentistry. In a way, we're the captive audience. The patients in our operatory for 35 minutes, 45 minutes, an hour, depending on, what the procedure is, you're the captive audience. You can't go anywhere. You're in that operatory with them. And if you've been around any length of time in dentistry, you know what I'm going to say next is true. If people want to say something, they're going to say it. "No, I got my fingers and my instruments in their mouth for the whole time." Oh no, trust me. When there's a moment, They'll get it in. Are you ready?
So here's the thing. The responsibility of the dental professional and or a healthcare provider is significantly different from that of a bartender. There's definitely liabilities that we have that they don't have.
True.
And one thing that is a fact is that if a patient were to tell you that they are having a suicidal thought or they are thinking of committing suicide, that is a medical emergency. That is not a, hey, you got a lot of runway, temporary, problem, permanent solution. No, no, no. It is not our job to serve as a therapist. It's not our job to serve as a cheerleader. It is our job to get them the help that they need. And so if somebody were to tell you that they're feeling this certain way, it is our responsibility to get them the care that they need, not give them a good pat on the back and a hug and send them packing. We cannot do that as a healthcare provider.
Right, that's the point, Pam. Exactly right. In other words, if it can happen to a bartender, it can happen to you. And are you ready to do what you just said, to render care, to get them in contact with somebody that's going to be able to help them? Are you ready to hear those words, and or will you be so shocked to hear them that you'll be frozen and unable to act? That's what I hope to get from this podcast to the audience is to bring them awareness like, hey, this could really happen. It could happen tomorrow. Am I ready for this? Do I know what steps to take? Do I know that I'm obligated as a medical professional to do these things? Or am I just going to sort of pretend I didn't hear it and brush it off? You can't do that. It's a medical emergency. You have to be able and ready to act. Are you ready? Because if you're not, this is a call to every office manager, every person who works in an office, hygienists, assistants, dentists, especially if you're the dentist and you're the practice owner. This is a wake-up call, a call to action. Get your staff ready because suicidal ideation is becoming more and more common, especially since people can think they can use drugs like cannabis and so on to treat things like anxiety and depression. And all that ends up leading up to sometimes is more thoughts of suicide. Be ready, have a plan of action. And as Pam just said, know that this is your responsibility. Yes, the bartender analogy is simply it can happen to you, but now it's one step further because you've got to be ready to act. And if you're not, that can harm not just the patient, but you, knowing you could have acted and you didn't.
That's a big deal. So having a plan is really important. Communicating with your team and having a plan as a team is incredibly important. And having communication between hygienists, dentists, assistants, dentists, there's always time where you might end up in the operatory alone and the patient confides in you in a certain way and you might not know what to do. And you shouldn't feel alone as a healthcare provider, especially when we're fortunate enough to work in a team setting. So have a plan for these things. I know at the university, that was a code. That's a medical emergency. It's the same thing as a heart attack or a stroke. We would get them immediate care because they need it if they're really seriously considering doing that. And it's not our job to decide, are you serious? Or are you just sort of saying something because you're in a bad mood? No, 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 no. It is not our job to do that. If somebody's saying something that is that serious, we need to get them the help that they need. So whether it's medication induced, psychosis induced, our medical condition induced, again, that's not it's not within our purview or our scope to be able to identify those things. It's our job to get them the help, the care that they need. So this was not my favorite topic, but I think it's one of the most important and impactful topics we could discuss.
Now, let's keep in mind also, sometimes it's so traumatizing to hear that those words come from the patient's mouth that afterwards you all want to talk about it. So please remember that that's information that must be kept private. So if you're going to have a conversation about it, make sure it's, in a room where the door is closed, because if you talk about it after the fact and that next patient happens to know that patient, privacy is everything when it comes to this. So please have those conversations indeed in private.
Absolutely. All right. Well, I think we maybe helped somebody out there today. So thank you for bringing this topic up.
Thank you, Pam.
All
Take
right,
care.
everybody, from Medical History Mysteries, we'll see you all next week.